My name is Dr. Dan Delrose, and I place dental implants in this practice. I want to be your dental implant advocate. I'd like to have you think about 3 things before you get a dental implant. It's medical considerations. These are the same considerations that your orthopedist would ask for before they gave you a hip or a shoulder. It's all the same kind of titanium that we use in the mouth, that we use in the shoulder and the hip. So why should we ask for some medical considerations when we're placing a dental implant? The first thing that you need to know is your A1C. A1C is a diabetic type of equation that we're looking at, and we're seeing what the glucose is in your body. Why is that important? The higher A1C is, the more chance of getting microangiopathy, meaning that the blood vessels start dying. A lot of our diabetic friends, they always get their eyes checked because of retinal problems, right? Because of the small blood vessels. Well, we have small blood vessels in our jaw too. So it's very important to check your A1C before you get a dental implant. It should be below 7, okay? The other consideration, I do want to talk one more thing about you would think in Florida, Dr. Delrose, I'm out in the sun, my vitamin D is really good. You'd be so surprised how people in the United States, their vitamin D level is so much lower than elsewhere in the country. That's another thing we ask you to check, is your vitamin D level. It should be above 30 nanograms per deciliter. If it isn't, I recommend that you get on vitamin D3 at least a month before you do your dental implant surgery. And the last thing I want your consideration, it's the same consideration once again that our orthopedic colleagues consider, is your cholesterol, your lipids. You should do a lipid panel. If your lipid panel is high, your cholesterol is not as high also, it will cause the implant not to integrate properly, be it a hip, shoulder, or a dental implant. The nice thing about lipids, if your vitamin D level is low and you start taking vitamin D, we know also through research in 2023 that will also decrease your cholesterol and your lipids. So the vitamin D and your lipids all correlate with each other. So once again, if you're thinking about getting a dental implant, make sure your A1C is less than 7, make sure you're taking vitamin D or your vitamin D level is over 30, and have your lipid panel checked to make sure that you don't have a lot of cholesterol or high lipid issues. If you have any questions about getting a dental implant, come by our office and see us right here in Ellington.